British Partnership NHS Trust is looking for physiotherapists and occupational therapists to join our multidisciplinary teams. Some of our staff tell you why you should join them.
It's a fantastic place to work. It's one of the best places I've ever worked. We have brilliantly supportive teams. My colleagues are equally supportive, and they're really interested in developing you as a therapist and seeing you reach your potential.
Talking to previous Band 5 physios that we've had here, they've developed hugely in that first year. So when they start, a lot are quite nervous and wondering what the expectations may be of them. But with the support that we provide and the regular training, they find that they develop a lot, amazed actually of what they've learned and how their skills have been enhanced in that first year.
I started my career in LPT following graduation as a Band 5 physio. I got a static post within Colville Community Hospital, and through working really hard with the staff here with their immense amount of experience and time to develop junior staff, I was able to, within a little under 18 months, progress to a Band 6 level within the trust as a senior physio.
You're just warming up, that's what.
There's a huge amount of variety, and we get a lot of different patients, a lot more of acute patients than we used to several years ago. So we have falls patients, orthopaedic patients, dementia, various neurological patients, and then at Colville Hospital and St Luke's there's a stroke unit, and so we have strokes that may only be 2 or 3 days post-stroke, so we get quite a lot of acute care as well.
This would be a really good place to start, a really good place to get your grounding as a therapist, find your feet, so to speak, and really develop your core skills that are going to be necessary for the rest of your OT working life.
So what we want you to do now is that we're going to move the ball side to side, you control it, and you only move it as far as you can control it, okay? Okay, so this is too much, for example, yeah?
You can develop your skills as a therapist with rotations which will take you to all areas of our organisation, and we also give newly qualified therapists a preceptorship programme to structure their learning.
That's it, slowly control it, and back to Anita.
LPT looks after its staff brilliantly. They are extremely good at supervising junior staff and ensuring that they develop to the best of their potential, and I feel that the rate of my progression wouldn't have happened without the support of the senior staff and from sort of the management around me. There is an extensive training programme as well. We have lots of in-service training sessions. We have opportunities to attend courses as and when that's available. And the staff I work with are so well experienced, and they will devote a lot of time to make sure that you can achieve a standard that they're achieving.
In-service training which happens every week, and that may be a journal club, we may have external speakers come in, any courses that we've been on then we feed back, but we also have regular access to other courses. So we provide some core training every year which tends to be based around respiratory, orthopaedics, neuro, but we also try and have internal courses and then funding for external courses. So we have regular emails that come through every week, so if there's, or every month rather, so if there's a particular course that somebody wants to go on, then they can request that.
I love it, I love it. It's the best thing I could have ever done.
Say come and join us. If you want to come and have a look around at any of the hospitals, I know all the other team leads would, welcome you to show you around, but they're a really good place to work with a lot of variety, a lot of support, and I recommend it. We offer clinical supervision, which happens on a regular basis. So that may be peer supervision, group supervision on an individual basis. We have a lot of joint sessions together with the patients, just providing that support, and also meet every week to go through a caseload management to make sure that the member of staff's happy with how they're organising their time, the treatments that they're providing, any issues that they may have.
If you're thinking of coming to work here, you know, you can be guaranteed there will be people behind you to support you. There will be people who will help develop you. There are lots of training opportunities that you can go on, that you can learn off seniors who are incredibly experienced. Here I work with a clinical specialist within stroke, and we have lots of opportunities to develop our own skills as well. And you know, you can push yourself as far as you want to go, really, and LPT will really support you to do that.